Good morning and good evening in Europe. Stress and what happens when you don't deal with stress. Yoga Nidra or Yogic Sleep. How can it help? Is there a science behind Yoga Nidra? Well, Yoga Nidra was known to be practiced by sages in India and it was passed on to their disciples traditionally. Exploring this fascinating topic, we have Ellen Aarts, a stress relief expert and a certified yoga instructor for the last 14 years. Ellen transformed herself from a busy corporate life to finding inner peace. I am Amita from Nourish Doc, a platform for natural and holistic therapies. I'm excited to introduce all of you to Ellen Aarts live from Spain. Welcome, Ellen.
Thank you, and welcome guys at home. Good that you're watching. My name is Ellen, and in this presentation I will be sharing the background and mainly the practicalities of of Yoga Nidra and as best kept secret really as an amazing stress relief tool. And I want to focus on how you can use it in your daily life to alleviate stresses and to enhance your sleep. So what I will be doing first is to give you the theoretical background in 20 minutes or so. And what I wanted to do then is to guide you through a shorter yoga nidra, something like 20 minutes. So we have a break after the theoretical part, and then you can experience it yourself, okay? So let's go. When we talk about yoga nidra and stress, it's important to have a bit of a backdrop, bit of a background on what stress is. So the American Medical Association defines stress being any interference that disturbs a person's physical or mental well-being. And in our bodies, what happens is that there's 1,400 chemical reactions in the body. So 1,400 of which cortisol, which you might have heard of, and adrenaline. And what they basically do is our body gets prepared for the attack, right, of the tiger or of the potential accident that's happening, or in our case, usually a deadline. So our muscles tense up, the muscles in the legs get ready, our respiratory system gets prepared, our shoulders get prepared, everything basically in our body gets ready for action, right? That's the fight or flight mode. And next slide, please. Yes.
Sure.
But what is important to realize here is that's the nuance I like to make, is that stress, of course, is not a bad thing, right? We are organisms, we're animals, we need to grow. Without growth, we would experience atrophy, which is basically death of the cells, right? So we want to grow, we need stress, but there's a difference between acute stress, so that type of stress where we go into action and where our body can actually release all those 1,400 chemical reactions that were being released. It is the chronic stress that is a problem, because in chronic stress, we are under a continuous amount of pressure, a continuous amount of tension that's being put on our bodies. And that is the stress, that is the tension that we do want to address. Because when we don't, chronic stress causes all kinds of problems on the mental side, on the emotional side, and also on the physical side. So here there's just a few examples of any psychosomatic illnesses that we can experience. The mind giving our body signals that something really is not right. And the few examples, but of course there's many, many more, are insomnia, not being able to sleep, fatigue, burnout, high blood pressure, hypertension, tissue repair, all kinds of ingestion problems, growth problems, problems with, well, any type of problems really. And there's a lot of emotional problems as well that are not on this list, but let's say anxiety attacks. So we really want to look after ourselves, and we really want to bring awareness to not only what kind of stress we experience, what kind of tension we experience. And I'll take you through the stages as well a little bit later. But we really want to make sure that we know what to do when we're under all this amount of pressure, because that will give us tools that will really empower us on a mental, emotional, and physical level. So another way of looking at stress, which I quite like, is the amount of challenging situations we face divided by our ability to cope. And then you will see that we can work on, let's say, the amount of stresses we experience in our life, right? So we can change our lifestyle, but we can also, from the inside, work on our ability to cope. And we have a problem when unattended tension, and I use tension and stress here as two sort of separate but also similar words. Stress being more of an umbrella term, tension being more of the, let's say, a physical term. Okay, so when we don't address that and our harmony in the body, our equilibrium, even at rest, becomes disturbed, then slowly but steadily, our nervous system will respond by manifesting all kinds of, again, psychosomatic illnesses, varying from insomnia, anxiety, irritability, but often leading to neurosis, and that's what you really don't want. Yes, next slide, please. And what I wanted to show now is a bit more of a theoretical, scientific backdrop of stress. So what both psychology and the yogic philosophy agree on, and what they say, is that there's basically three types of tension. One being the, let's say, superficial part of our body, right? So the muscular parts. You might know that when you're tense, your body starts to respond. Your shoulder starts to tense. It's like your whole body starts to contract. The muscles in your legs get ready, and that tension often stays. So it's on the body and nervous system department that we experience that type of tension, and our hormones, our endocrine system experience imbalance as well. Then again, there's the emotional side of things, and this is a bit more difficult because this happens a bit more under the radar, so to speak. You might start to experience anger, sadness, which of course are human emotions, but there it gets a bit more muddly on that department, because we start to experience all these various dualities of very different emotions. And these are a bit more difficult to track. Then the third level is the mental tension we can experience. And maybe this is something that you can relate to. There's, through excessive mental activity, this ruminating, this flow of thoughts that we can't stop, this dwelling on what might happen in the future, this just not being able to step out of our head, and there's a accumulation of mental tension happening. And there has been great research done in the Banaras Hindu University by actually stating 4 types in which stress is causing problems. And I just want to take you through that because I think it's super important, and I think the background of stress is very often overlooked. And the more we can become aware of the process of stress and tension, the more we can actually find solutions for that. So the first part is the psychic level of stress. That is the stress in the mind. That is someone might look worried. They start to dwell, again, what I just said. They start to dwell on future disasters that might happen. At that point, nothing is wrong quite yet, but there's something going on. When that is unattended, we go to the second stage of cultivating a stress disorder, which is the psychosomatic part. Psycho meaning the mind, somatic meaning the level of the body and the tissues. So what is happening on the psychosomatic part department is that you might start to get heart palpitations, you might start to get sweat attacks, your blood pressure rises. So all kinds of different symptoms that rise up on the body level. And then somatic, the somatic part meaning stress will find an organ, one particular organ, where it starts to cultivate all kinds of different symptoms. For example, an example is that your acidic level in your stomach gets elevated. And when that is not being attended, we reach the organic phase of stress, which is that stress is really starting to fester in one particular organ to the level where it actually destructs one particular organ. So in this stage, the last stage, you need either surgery or pills. And the good news is that it has been found that Yoga Nidra is actually a very effective treatment on both the curative and the preventive side for the three first stages that I just mentioned. So when we actively practice with Yoga Nidra being a therapeutic tool to alleviate stress and to diverse the effects of stress that are happening, is we can actually stop ourselves from a very detrimental phase of a stress disorder. So that's the good news. So I want to take you to Yoga Nidra itself now. So Yoga Nidra being a very systematic way of removing inner tensions from the body, emotions, and the mind. So Yoga Nidra being meaning yogic sleep. So Yoga Nidra is really a super powerful way of staying awake, so staying conscious, but at the same time tapping into our subconscious mind and into our unconscious mind. So in that way, we can really retrain the mind. So it's like superfood for the brain, and knowing that all tension ultimately stems from the mind. So Yoga Nidra really allows us that tool to go into our depths and also to go into our deepest potential, right? Because maybe you know that picture of the iceberg where what we see in our daily behavior, in our daily action, in our daily thoughts is just a little tip of the iceberg. And what is below the surface is our unconscious, is our subconscious. And that's really where all our problems or our unsolved problems, all our traumas, all our tensions are being pushed down to. So through Yoga Nidra, we can really change the nature of our mind, and we can really, it's quite a big claim to diseases to be cured, but really it's science who backs it up, which is amazing. In the US Army, for example, they use Yoga Nidra as a very therapeutic tool to help their soldiers combat PTSD. So really what we do with Yoga Nidra is that we go into the deeper layers of the psyche, and they are being brought to a conscious experience. And through that, we can really release all the different layers of our bodies. So the 5 koshas in yoga, maybe you've heard of them. We go from the muscular tension, from the body level, ultimately into the mind, the psyche, and even the level of the soul. So it's one of the best kept secrets, really. So what we do is we relax the mind by relaxing the body. And you will experience that later as I take you through a shorter guided Yoga Nidra, where it's a scientific way. That's why it's very important to have a good teacher, by the way, because unfortunately there's a lot of teachers on the internet who do not honor the pure tradition, which is the Yoga Nidra from the Bihar school in India, from Swami Satyananda Saraswati. It's a very beautiful, very pure way of, it has a system, right? And you really don't want to deviate from that. So it's by relaxing the mind, it's by relaxing the body, sorry, that we ultimately relax the mind. So by learning the body, learning ourselves, by taking ourselves through this method of Yoga Nidra, it's how we learn to become still. It's how we learn to relax. It's how we silence the mind, our emotions, our breath, our body. And through that, just 2 minutes sometimes of experiencing your true self. And with that, I mean that part of ourselves that resides underneath all our tension, right? It is a very healing, it's a very blissful experience for many people, which has very amazing effects on our minds and our emotions. And what Yoga Nidra does is, yoga, other types of yoga do that as well, but it's called pratyahara. It's interoception, which is a term that's often being used in psychiatry, for example, by people who need to overcome trauma. It is the eighth sense of looking inside. They say that the only way that we can change how we feel is by changing our focus, right? Right now, our senses are so on all the time. Our minds are so extroverted, our senses are so extroverted that the medicine really is, and luckily I'm being backed up with science here, is to focus our attention inside. So this is how we improve our self-regulation, right? Our, let's say, response to what is happening outside. And that is a very powerful way of changing our ability to cope, right? Knowing that what I said, stress is challenging situations divided by our ability to cope. And through pratyahara, through interoception, by going inside and changing our landscape there, is how we can ultimately change our ability to cope with difficult situations.
How does Yoga Nidra work? Maybe we can talk about that before you go into a demo, Ellen?
Yes. So I think I've got just 2 more slides, right?
Yes, yes.
Yes. So I'll be quick, and then I'll take you through the demo so you can experience it yourself. So what Yoga Nidra really does is that on a physical level, on the deepest level, is that it braces our body tissues for stress. So we can really reverse stress and we can really protect ourselves from that. So through Yoga Nidra, even our organs get a deep rest. And we basically change the neurohumoral reactivity to stress. So really curing any psychosomatic symptoms.
That's actually very, very powerful. And then the Yoga Nidra and sleep, if you could talk a little bit about how it helps with sleep. A lot of people have issues with sleep disorders nowadays.
Exactly. So I looked into the numbers, which to me were very shocking. And in Europe, where I live, it's the portions are the same. So 70% of all Americans obtain insufficient sleep. And sleep-related problems, insomnia being one of them, affects 50 to 70 million Americans. And of course, stress is a big problem of not actually being able to sleep, right? The ruminating minds, the not being able to stop our thoughts, the just being so on that we don't know how to actually switch off to the level that we can sleep. So I wanted to just ask you and check for yourself, of course, for you to ask and to reflect on how you sleep, if it is difficult for you, if there's a pattern, if you would like to improve your quality of sleep.
Yeah, I think all of us are going through sleep issues, especially during COVID times and other things that are going on, especially in California, there are fires going on. So, one thing leads to another. But even a normal person with a stressful life, even let's assume the COVID wasn't there, even then I feel that a lot of people have sleep issues. So, Yoga Nidra,
Exactly.
a demo of Yoga Nidra would really help our viewers if we can do a short demo right now.
Exactly. It's and the good news is that with Yoga Nidra, for example, we can do a lot. So if you suffer from insomnia, they say that after 2 weeks already, if you would practice it on a daily level, you can experience relief. And what Yoga Nidra does is that it will help you fall asleep. So it will decrease the time that you actually fall asleep, but it also very much enhances the quality of your sleep, knowing that 1 hour of Yoga Nidra equals 4 hours of conventional sleep. So let me just stick you, I think we go to the last slide, right? And then I
Yes,
can just,
yes. So let's talk about the stages of Yoga Nidra.
yes. So remember that I said that it's very important to find a good teacher, right? Because every good teacher will honor, if you ask me, the pure tradition, which is the BR school in India, the Swami Satyananda Saraswati. So every Yoga Nidra would take you through different stages. And I just wrote them down here, and you will find them back in the example I take you through as well. So always you would start with, let's say, any form of physical and mental relaxation. So you will hear a Yoga Nidra instructor quite often take you through sounds. So what you do with that is you very actively relax the body, you relax the mind so that the mind becomes still, and the mind basically wants to obey and wants to go into that stage of pratyahara. Then almost always you're being asked to plant a seed, a resolution, or some kalpa, which is a positive state, something that you'd like to achieve. And then usually that's being repeated at the end. So you plant a seed and you get the fruits of your labor through repeating it at the end. And then the most distinct part of Yoga Nidra is that you're being asked to do a body scan where the instructor will take you through, it's almost always the same, through rotation of awareness through all kinds of different parts of your body. Then you quite often will focus on feelings and sensations. And then you go deeper and deeper into the part of visualizations. And I won't go into that too deep because there's actually a whole science behind it, but that's maybe for another time. But we by that time we're already quite deep in the mind, and our mind through visualization starts to associate. We go into archetypes and the mind starts to purge. So it's like the mind's being cleansed, also with psychic symbols. So, for example, a symbol of Om, or you being asked to look at the space in front of your closed eye. So really, the mind, the psyche is gaining a very deep relaxation. And then usually there's silence, so the state of samadhi, meditative absorption. And in that silence, you can process, you can integrate everything that Yoga Nidra has brought up. And then the instructor will always ask you in their own way, but to return back again through a specific method. So it's a very beautiful, laid out, proven to work way of systematically releasing tensions.
Okay. So this is the last slide where we talk about the Yoga Nidra and sleep. It's why is it successful in treatment of sleep disorder? I think you've talked about this. Maybe you can summarize it. And
Yes, we talked about this. But maybe there's people who really suffer with sleep disorder or insomnia. And Yoga Nidra is a super powerful tool for that. But I want to put it a bit into context, saying that, of course, there's other things that you can do as well. So what they say is that it's super good to, of course, have enough exercise, have a very strict routine, so going to bed at the same time every day, and really make sure that your daily schedule is routines, is busy, and you have enough exercise during the day. And if you're super active before going to bed, then what is recommended is to actually do some sort of physical exercise. So you could also progressively contract all your muscles and then release. So you really help the body and the mind to actually then go into yoga nidra. But with just 2 weeks on a daily basis before going to sleep is a super powerful way of finding relief if you have sleep disorder or insomnia.
That's great. And now I think it's time to practice.
Yes, yes. So for people at home, um, I want to take you through a guided practice. So for that, what is best is that you choose a supine position. If that's not possible, then you can lay on your couch. But you want to lay in the Shavasana pose, right? So with your arms alongside the body, and usually the palms of your hands facing towards the ceiling. If that for some reason is not comfortable, then just place the palms of your hands on the floor. So let's just take 2 minutes or so for you guys to get set up, okay?
Okay.
Okay, let's start. So you lie down on the floor or your couch and close your eyes. And here, let your mind wander around the environment. And here, listen to sounds reaching you from outside. And don't analyze or intellectualize these sounds, but just become aware of them as something external. And now bring your attention to the body. Take a deep breath. And as you breathe out, feel yourself letting go. And now focus your mind on the meeting points between your body and the floor. And now at this moment, make your resolve. And the resolve will have to be very simple. Try to discover one naturally. A short, positive statement in a simple language. Stated 3 times with awareness, feeling, and emphasis. And now we begin the rotation of consciousness. Rotation of awareness by taking a trip through the different parts of the body. So as quickly as possible, the awareness is to go from part to part. Repeat the part in your mind and simultaneously become aware of that part of the body. Keep yourself alert, but do not concentrate too intensely. Become aware of the right hand. Right hand thumb. Second finger. Third finger. Fourth finger. Fifth finger. Palm of the hand. Become aware of your palm. Back of the hand. The wrist. The lower arm. The elbow. The upper arm. The shoulder. The armpit. The right waist. The right hip. The right thigh. Kneecap. Calf muscle. The ankle. The heel. The sole of the right foot. The top of the foot. The big toe. Second toe. Third toe. Fourth toe. Fifth toe. Become aware of the left hand thumb. Second finger. Third finger. Fourth finger. Fifth finger. Palm of the hand. Back of the hand. The wrist. Lower arm. The elbow. Upper arm. the shoulder, the armpit, the left waist, the left hip, the left thigh, kneecap, calf muscle, the ankle, the heel, the sole of the left foot, top of the foot, the big toe, second toe, third toe, fourth toe, fifth toe. Now to the back. Become aware of the right shoulder blade, left shoulder blade, the right buttock, the left buttock, the spine, the whole back together. Now to the top of the head. The top of the head, the forehead, both sides of the head, the right eyebrow, the left eyebrow, the space between the eyebrows, right eyelid, left eyelid, the right eye, the left eye, right ear, left ear, right cheek, left cheek, the nose, tip of the nose, the upper lip, lower lip, the shin, the throat, right chest, left chest, the middle of the chest, the navel, the abdomen, the whole of the right leg, the whole of the left leg, both legs together, the whole of the right arm, the whole of the left arm, both arms together, the whole of the back, buttocks, spine, shoulder blades, the whole of the front, abdomen, chest, the whole of the back and front together, the whole of the head, the whole body together, the whole body together, the whole body together. Now become aware of your natural breath, the spontaneous ebb and flow of your breath. And focus your attention on the breath as it moves in and out of the nostrils. And maintain your awareness of this for some time. Now count the breaths backwards from 11 to 1. And now again become aware of the body. And focus your attention on the meeting points between your body and the floor. Whilst you keep your eyes closed, visualize the space you are in. Imagining the four walls. Imagine the ceiling. Imagine the floor. And then you take one last deep breath. And you start to gently stretch the body. And then only when you're ready, take your time. You can open your eyes to end the session.
This is beautiful. So, a question, any questions from any of the attendees, please welcome. I just wanted to ask a question. It's difficult to do it by yourself, if So it's like a guided kind of, right? I mean, how does it work?
So it's best if you're new to this that you would just make it easy for yourself and just listen to a guided meditation from somebody else that's being recorded. And then
Yeah.
after some time, you could start practicing it on yourself. But usually, especially when our minds are so active, it is very helpful to just listen to somebody else, because then the work is being done for you and you just really have to lie down, put your headphones on, listen to a good recording, of course, and then just let yourself be taken, because it's so much more restful for the mind and for the body to just listen to the voice. But after some time, you can totally do it yourself, but you need to be a bit of a more, uh, you have to have a bit of practice for that.
That's right.
Yeah.
And I do want to say that Ellen, we will offer Ellen's Yoga Nidra class in end of September, October timeframe. So if you are interested, we will let everyone know who has attended this session or registered for this session as well. Okay, what
Great.
else and now you would like to talk about? We have a couple of minutes to wrap up. Any questions, please let us know. But Ellen, is there anything else you would like to say? Hello, Ellen, can you hear me?
I can hear you. Yes, sorry. I thought you were waiting for questions from the people who are watching. Sorry.
Any final comments from you? We would be announcing the class, as I said earlier, and Ellen suggests specifically, you know, if you are not used to this kind of guided meditation by yourself, she recommends that you take the Yoga Nidra classes from someone who is experienced, right, Ellen? That's what I'm hearing because.
Exactly. And I also wanted to say that if for everybody who wants to start practicing Yoga Nidra, I'd like to offer a 40-minute guided Yoga Nidra that I recorded. So it's a professional recording, which is important if it's close to your head. So for anyone who likes to listen to that, just to, I don't know, Amita, what is handy to just give me your email and then I'll make sure you get it. Okay, so you can start practicing. And then we can go more into the practicalities on the workshop that we will be doing in September. Then you can just start practicing yourself and
Okay.
enjoy practice.
That's great. That's great. Yeah, send us, Ellen, your recorded meditation. We will
Yes.
send to everyone who has registered for this class, and we can send it to them, and we can also announce when your live sessions or the workshops will be coming.
Perfect.
Okay.
Great.
Yeah, with that, I'd like to wrap up this session. Thank you so much, Ellen, for joining us.
Thank you for having me.
And for the viewers, please let us know, share our sessions. These are educational sessions we do every week on different topics. And Ellen Ellen is the one who started us with our first webinar. So I want to thank Ellen with that. And thank you so much. And signing off now. Have a great weekend. Bye-bye.
Bye-bye. Bye.